Hi everyone, TFL librarian Sharon here, and welcome to Lunch and Learn Online. The topic of our workshop today is how to find accurate and reliable health information online. Let's take a look.
The internet can be an invaluable health and wellness tool if it's used correctly. Whether you're trying to find out more information about a medication you're taking, a condition you have, and treatments that might work for you, the internet can help you connect with support groups and share your healthcare experiences. More and more people are looking for health information online. In fact, a study by the Pew Research Center found that health information is now the second most popular subject of an online search. And that's potentially a really good thing, because the more health literate we are, the better we are able to manage our health. The U.S. Department of Health and Human Services defines health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. Sounds manageable, right? Yeah, until you learn that, according to the National Assessment of Adult Literacy, only 12% of American adults have proficient health literacy. That's incredibly low, and it has pretty severe consequences. Low health literacy is linked to a lot of different poor health outcomes, including higher rates of hospitalization and higher healthcare costs. Today, I'm going to show you a couple of online health resources as well as some tips and tricks for spotting untrustworthy information on the internet. Just before we begin, though, remember that the best resource you have is your healthcare provider. While we can take a look at some great online resources, remember that this is not a substitute for professional medical expertise or treatment. First up is MEDLINE Plus, the National Library of Medicine's consumer health website. It's a compilation of easy-to-read health information assembled by medical librarians. This is a great site to keep in mind because it includes such a wide range of information. Here you'll find information on topics such as specific conditions, say diabetes, but you'll also find information about medications, including prescription and over-the-counter drugs, as well as supplements and herbs. You'll also find a medical encyclopedia and information about different types of medical tests. If I take a closer look, for example, at drugs, and then here in related topics under blood pressure medicines, you'll find a lot of information, including more about the condition, related conditions, specific information about different types of medications, information about clinical trials, who to talk to if you need an expert, and even patient handouts. Most of the information on Medline Plus is available in both English and Spanish, so this is definitely a site to keep bookmarked. The next site I wanted to show you is My Health Finder. Like Medline Plus, My Health Finder is a great general information tool. Created by the U.S. Department of Health and Human Services, My Health Finder can get you started by pointing you to good, credible health information quickly. You'll notice that they have a number of options, including a quiz right on the main page to help you determine which screening tests and vaccines you may need. Under their topics list, however, they have a variety of health conditions, information about what to do at a doctor's visit, suggestions for everyday healthy living, and for pregnancy. If I take a closer look under heart health, you'll see that not only do they have tips for how to keep your heart healthy, including some very specific tips here, they have information about what to expect at a doctor's visit and what to ask your doctor, tips for helping a loved one, and even some heart healthy shopping lists. Speaking of visits to the doctor's office, it can sometimes be difficult to communicate effectively with your healthcare provider. To help with that, the Institute for Healthcare Improvement created the Ask Me 3 campaign. Ask Me 3 is a program designed to promote clear communication between healthcare providers and their patients. Ask Me 3 suggests 3 questions that assist in improving communications between patients and healthcare providers. Those questions are, what is my main problem? What do I need to do? And why is it important for me to do this? You can find more information and patient brochures on their website. Well, I've referenced 3 different websites. There are obviously many more health resources available online. While lots of these sites are great, many others are not, and may instead offer information that is incorrect, outdated, or perhaps even deliberately misleading. As you search for health information online, take a look at the Trust It or Trash It tool, which is designed to help you evaluate the websites that you visit. As you can see on my screen, Trust It or Trash It encourages you to go through a couple different steps to judge first, who is behind the website, who wrote it, who provided the facts and where did they come from, as well as how current the information is, when was it written and when was it updated, and how did they know? What's the expertise behind the website? Your health and the health of your loved ones is very important. So we don't want to be using a site for research if we don't know who created the information, if it's outdated, or if it's not by someone who has the right qualifications, or if it's not backed by medical research. And again, you should always consult your healthcare provider before taking medical advice you find online. All right, to recap, we visited 3 different websites to find a good starting point for our health and wellness research, including some questions to ask our doctor at our next appointment. I've included the URLs for all 3 sites here so that you'll have ready access to them. If you're looking for more specific information, remember that you can always contact your friendly neighborhood librarians and we'd be happy to assist you in your research. Okay, that's our time for today. So thank you so much for taking a look at online health resources with me. Remember that in-library computer use is now available, and we are very excited to be adding new services in a safe manner. Thank you again for joining me this afternoon, and I hope you have a fantastic day.